But if we zoom out a little bit and go a bit more generally, and perhaps the best way to begin would be to sort of, well, hand it over to you and see how would you begin this conversation in clinic, because it is a bit of an uncomfortable and it can be a bit daunting, and everyone is a bit different. So yeah, how would you go about this tackling this topic?
Yeah, so I think it really starts sort of after you're comfortable with the diagnosis of the patient. So you know that it's the problem is the hip. The hip is significantly destroyed. That means that a joint replacement is going to be an appropriate thing to do for this patient. And then you sort of that your head switches and it's not a diagnostic mode anymore, and it's all about treatment. So you talk about conservative treatment options. What pain relief they've taken. Activity modifications, physiotherapy, possibly injections can sometimes be helpful for some patients, or surgery. And then, when I start talking about surgery and hip replacement, I start with what I think is sort of the most important things for them to remember. So I say, whatever we say about risks, later on, I want you to really remember that there's a 90 to 95% chance of you having a really good outcome. And that hip replacement is one of the most reliable operations. You compare it to all the other operations that are done on the bowels, heart transplants, brain surgery, all these kind of things. Nothing is as reliable as a hip replacement, perhaps apart from cataracts.
Yeah.
But it is really, really reliable. So 90 to 95% is the sort of figure that I try and get people to remember. But obviously the flip side of that is that there's, probably a 5% chance of it not going perfectly well. So 5% chance of perhaps having ongoing issues or specific complications. And then I'd kind of, then continue on to talk about what those specific complications might be.